Caribbean Today is delighted to welcome Dr. Karlene Lawrence, who is a doctor of nursing practice specializing in preventive healthcare. She's part of a leadership team that will be spearheading a multi-million-dollar healthcare program whose goal is to transform the healthcare workforce and community in Brooklyn. She holds a bachelor's degree in nursing, a master's in midwifery and women's health, and then earned a doctor of nursing practice degree from SUNY Stony Brook University in 2019. Dr. Lawrence will be discussing the importance of preventive healthcare and her role in the new government healthcare initiative in Brooklyn. Hello, Dr. Lawrence.
Hi, how are you? Thank you for having me.
Well, thank you for joining us. We appreciate it.
My
Okay,
pleasure.
all right. Now, let me ask you, Dr. Karlene Lawrence, please share with us your exact title at this moment. I know it's a long one, so.
Actually, I shortened it. So my title at the institution where I work is just I am the nurse practitioner. I'm an adult nurse practitioner, exactly what you said, and I'm a doctor of nursing practice in our preventive health and wellness clinic. So I
Okay.
shortened it. Yes.
Yes, okay, so Doctor of Nursing Practice, okay. Now, can you please tell us from your perspective, what changes have you observed in the transformation of the healthcare system? How has it evolved over the years?
The healthcare system, unfortunately, has become more complicated for our patients and their caregivers to navigate because of the introduction of technology. Is there are persons that are not very versed in the use of technology, so it's made it more complicated for them. And that became really apparent during the COVID-19 pandemic when we transferred from a lot of in-person appointments to protect our patient population to telehealth visits where I would be in the office, but our patients would be in their homes and we would connect to them via telephone or via video, Zoom videos like these. And we came to realize that a lot of persons have really bad Wi-Fi, the internet connections, which made it difficult for us to connect with them and get good responses, or they didn't have any Wi-Fi at all. So that's when we would use telephone also to speak with them. So that's we've become more technology focused, our use of technology, and it's not always for the betterment of our patients.
Right, I agree. And older patients, it's difficult for them to, operate the technology, to do telehealth.
Some
That's,
young persons also, we came to find out, we were really surprised that some young persons are not any better. So,
as well,
yeah,
huh?
yes.
Okay. Well, all right. So is there anything you felt, right, that should have been done differently back then that still hasn't changed today?
So our population, so where I work is a very diverse community of Caribbean, South Americans, persons from other countries in Europe, Africa. We are in like a melting pot where we are, which is really good, the patients that come to see us. What we've come to realize is that our delivery of healthcare has not really benefited or kept up with the changing times or with changing demographics of our population. We our students, which is part of our grant, we're trying to teach them at this point or emphasize to them at this point the necessity of speaking to our patients in regular English or whatever
Mhm.
their language is, because we have interpretation service and not speaking medicalese. It's difficult to explain to them and to ensure that they understand what we're trying to help them to achieve and not just speak over their head. Because our patients from the Caribbean will defer to them and say yes to everything, even if they don't really understand. So that's what we're trying to change, is to make our healthcare providers going forward, currently and going forward, more dementia friendly and more healthcare friendly,
Right.
and really speak to our population and ensure that they're getting the information that we're trying to give them to improve their health.
Yeah, I know. You know, you said that the challenge is that some of the older patients are not understanding,
Yes,
healthcare discussions, you know.
definitely.
And what are some of the ideas you think they would have for addressing some of the, some of that communication deficit?
So preventive health and wellness, this burgeoning healthcare format or plan is to make sure that our patients uh, are more involved in their care. They
Mm.
so that's why we want to make sure that they understand. So patient education and teaching is very, very important. Getting them to agree to the plan. So our grant that we have that we're working on, one of the main goals of the grant is to understand what matters to the patient. So we as healthcare providers need to understand what our patients want for their healthcare, and we try to assist them to achieve that. So that's the number one thing. So patient education and teaching is the number one thing. The second thing is also to get them to understand, as I said before, what we're trying to assist them to achieve. And one of those is, if this involves medication, is to cut down on giving them too many medications at the same
Right.
time, especially
Yeah.
if they don't know what don't understand what they're for, they will not
Yeah.
take them, or they may take them incorrectly. So we're trying to cut down on polypharmacy and make sure that they're taking their medications as prescribed. And the other thing is to assist them to stay in their home, stay healthy as long as possible in their homes, aging in place with their relatives, and to provide assistance to the relatives, because it's very hard taking care of older adults. They get
Yeah.
burnt out. They're like sandwiched in between taking care of their children sometimes and taking care of their parents. So we're giving them more assistance to help them to take care
Yeah.
of their parents. So they want to stay in their homes and also to
Yeah.
keep them healthy, the caregivers.
Well, can you talk to us now about the Geriatric Workforce Enhancement Program that received that multi-million-dollar grant from
So,
the federal
so that
government? Let's
So,
hear.
yes. So we actually have two grants on our service. We have one from New York State, and we also have one from the federal government. And fortunately, they have the same goal. This is the focus right now of healthcare in the United States. As I said, is to educate our workforce, our providers, to be more in tune with our patients, to listen to our patients, and not only just tell them this is what you should do because this is what we think is best for you, but to get buy-in from them that this plan of care, this healthcare plan, is what they also want to achieve, and this way they will accomplish that. So that is part of the workforce enhancement grant. And as I said, also to educate the next generation of healthcare providers. So this is
Yeah.
we have students from all the schools um, come in to rotate on our our floor, our clinic, in our
Mhm.
clinic, to learn how to take care of patients, and we observe them, correct them, and teach them how to do that better. Because a lot of students come in with stigmas about older adults, like things that they think should be happening as they get older, and not really speak to the patient, observe what is actually happening with the patient.
Yes. They sometimes have a lackadaisical, attitude towards older patients,
And
and
stereotypes about, yeah, a lot of
yeah,
stereotypes.
right. Their feelings should be considered and But so will this program the program is going to start is it a pilot in Brooklyn?
This is actually not a pilot. This is our second time. So we've had this for the last 5 years, which ended in June of this year, and we're starting a new cycle of the same program. We started in July, and that's going to go for another 5 years. So we are actually fortunate that we got selected again to continue what we started and improve on it, and hopefully begin to see some results from that.
So will the program spread out to other states? I mean, do you think other states will be able to assimilate this or does a grant it's a federal grant, so would it
Yeah.
involve other states
Yes, it
eventually?
does. No, it actually does. So the federal government has given, I don't remember the exact amount of how many allocations to different schools, different hospitals in different states. So we are spreading this out across the country because as we've become aware, our population is aging. The majority of the population is over 60 right now. So we are trying to
The
educate
majority, you said, the majority of the
the
population?
majority of the population go globally is over 60. We're an
Oh,
aging
wow.
population, unfortunately, or fortunately, because we're trying to catch up and actually involve them in their care. So there other schools, other states, other hospitals other institutions have also been allocated a grant similar to this. We are fortunate that we've had this the second time in Brooklyn, in New York.
Okay. So, just tell us briefly some of the important things we need to know as we're aging.
There the goal of this grant also is to prevent, so preventive health, as our pyramid
Preventive.
goal, as prevention is better than cure. So we want
Yes.
to have patients get in the habit, regular habit of coming to us before there's a problem. So don't come to us when you start having pains. Don't come to us when you start having difficulty hearing. Don't come to us when you're passing out at work because your blood pressure is too high. So that's what preventive health is. You are going to schedule visits at hopefully about the same time every year and just come in for a screening. So screening is before the illness happens to see if you have it. Hopefully you don't. And then we do preventive health, which is vaccines, teaching, the patient education that I told you about, just sitting down, seeing what's happening in the patient from head to toe, which includes their social life. Do they have enough food? Do they have somewhere to live? Are they homeless? Do we need to intervene and assist them with that? Do they have the income to buy the medications that they need or to buy healthy foods? So that is what that is. But there are certain chronic conditions that are unfortunately, again, predominantly happening in the Black or Caribbean communities. And as you said, the top three is what I call the triad. It's the diabetes, high blood pressure, and high cholesterol. And a lot of patients are not aware that that is tied into the foods that they're eating and their lifestyle.
Yes. So that's where the prevention comes. And it
Yes.
starts early. I mean, as early as what, your 30s, you know? You don't wait until you're older to cut back on salt or start eating properly,
No.
right?
So
So,
that's where the annual wellness visits, where they come in and we're teaching them as they're aging, hopefully from in their 20s, that this is what this is what you should be doing to keep yourself healthy as you get older. And there are screenings, they're called age-specific screenings that, and again, we're saying screenings, as I said before, because this is before you get the illness, to screen if you have it, and hopefully you don't, and then we'll help you to not get it as you get older. So there's screenings that are recommended, and again, to go with the triad, there's a screening, the taking your blood pressure regularly, watching your weight. If you do have cholesterol, if your doctor says your cholesterol is high, then to start taking your medication. If you have diabetes, although there's no symptoms, definitely take your medications as prescribed. So that's where the screenings come in. And then there's a breast cancer screening, there is prostate cancer screening for men, breast cancer for men and women. There's colon cancer screenings again, and we're trying to catch any cancers that may be developing before it becomes untreatable or where the treatment is more complicated and the outcome is not as good.
now, let's talk about insurance because healthcare comes with insurance, right? So, given the lack of affordable healthcare and the rising costs of health insurance, can you explain explain why preventive care is important to, offset some of these, exorbitant costs of, treatment and
So yes,
screening?
healthcare is actually important, and that's another problem that is facing our community and our patients. Some do have insurance, some, and it may not be enough. That means it leaves them with a higher part of the bill to pay themselves. Some don't have insurance at all, and that's where our social workers come in. So it's an interdisciplinary team. They help them to apply for whatever insurance they may qualify for to help them. And if they do have the insurance, then they're more apt to come in. If they don't have the insurance and they have to pay out of pocket, that's when they don't
Yeah,
come in. And that's the
that's right.
problem. Yeah, health
Yeah.
insurance is so complicated. Some persons cannot navigate it themselves. So that's again where we come in and help them to get the services that we need and that we've agreed with them that is best for them.
You said this program, when does this program start? You said it's the second,
The second
um,
allocation of
and
this program,
from,
yes.
yeah. So, and so how does it really work? I mean, it starts with the clinic
So
and
it started again, the second round started July of this year. So our patients go to their healthcare provider. So most insurance companies require them to have a primary care provider. That's like a gatekeeper. So you go to
yeah,
your primary care provider and you're complaining about something's happening. I'm not hearing as well as I was before. I'm going to the bathroom too often during the day, whatever it is. And your healthcare provider refers you to us. So they will give you a referral and they'll assist you hopefully to call us and set up an appointment to come into care on our service. So that's how it's by referral. And hopefully as it catches on and becomes more popular and people know that we're there, then it will be by word of mouth. And that's the best referral by word of mouth.
okay. Well, I guess that's it. I guess we wanted to hear about preventive health care. You know, we wanted to introduce you to, our audience
Thank you
and
so much
also
for
the
that.
program. Yes, and also the program um, that you mentioned, Geriatric Workforce Enhancement. I'm going to ask you to tell us again, how does it work
So
as
our
far
population is mostly adults age 60 and over. As I said, most of the population is aging. They will go to their primary care provider, who's the gatekeeper. So for most health insurance, there's a gatekeeper, and that's your primary care person. They will then refer them and hopefully assist them to connect with us and make appointments to come into care in our service because we have an interdisciplinary team of healthcare providers, myself, like a nurse practitioner. We have physicians, we have psychiatrists. As I mentioned before, we have social workers, occupational therapists, we have pharmacists. So this is a all-inclusive healthcare
it's
discipline.
just one building, it's a building.
It's a building, yes, but we have different providers that are on this grant. So that the other thing, the other benefit is that when the patient comes to see us, they don't have to leave and go and make an appointment somewhere else to see the therapist.
Someone
They
is
don't
in the
have to go.
building.
Everything is inclusive. So this way they don't drop the ball and we could follow up so everybody's there. We could see their notes so we could continuity of care. We could see, so the physical therapist recommended this, so when they come in to see me, I could follow up and like, did you do whatever the physical therapist recommended for you? So having a healthcare team all in one place is actually
Good
more,
idea.
yeah,
You're
better
right,
for the patient.
because once
Yes,
they leave, you're not sure if they're going to follow
right,
up. And they're
exactly.
now, what is written on the building? What is the building called?
Oh, this is SUNY Downstate in Brooklyn. This is where we are.
Oh, so that's where it's going to be located at SUNY
Yes, the
Stony
State
Brook,
University of New York,
downtown, downtown New
downstate,
York.
downstate medical center. Yes.
Okay, I'm just trying to let our audience in Brooklyn know or in New York know where to come to. So how would they reach out to
So at the
your,
moment, they could reach out to me. I have an Instagram page set up. It's called Prevent is better than cure. Prevent. So they could reach out to me. Prevent better than cure 411. It's on
yeah,
Instagram, and then I will
okay,
pass it on to our front desk to reach out to them and schedule their appointments. I think
okay,
that's the easiest way. Yes. So
all
as I
right.
said, our parents always says prevent it better than cure. So
It
prevent
is,
better than cure
it is.
411.
Yeah,
Yes,
for
that's
one.
411. Yeah, information.
Yeah, information. Yeah.
Yes.
Okay. Well, it was absolutely wonderful talking to you. All right.
Thank
It
you
was
so
nice.
much.
Thank you for this informative and important conversation and much success with your endeavor. You're
Thank you
spearheading
so much.
this program. You're
And
part of the
sorry for
team.
the
Yeah.
sorry for the technical difficulties. And just one more thing. This is still October Breast Cancer Awareness Month. So make your appointments. Although you may have to wait a while to get your appointments, definitely make it and keep it. And for the men, Prostate Cancer Awareness Month was back in September. So don't think you have to wait till next year, September, to make an appointment. Definitely make your appointment and keep it. And definitely we're here to help you stay healthy.
Okay. Wonderful. Thank you.
Thank you so
Thanks,
much for
Dr.
having
Lawrence.
me. Thank you very
Yeah,
much.
until next time. Bye-bye.
Yes. Bye-bye. Thank you again.
Thank you.